So the article that I chose was regarding aminocaproic acid. It's a drug that helps with the heart during surgery. It's widely used and it's cheap and very safe. It's never caused any damage, and there's a shortage on it, a national shortage on it, due to an issue in the production companies. It prevents hemorrhages during and after surgery. So, let's see. I think that there are a couple of principles applied in this because the on the hospitals have on staff ethnicians, eth, eth, people looking over the ethical bylaws and things of that every time they need to use it. One struggle that they're really having is in the pediatric wings. They'll have two kids who are in need of this drug, and they'll only have one supply of it, and struggle with making the choice of who they're going to give it to. The principle of distributive justice is one that I think they're trying to follow to the best of their ability by having these people on staff, making sure that they can be aware that the drug is being distributed appropriately. Unfortunately, with the shortage, it comes down to exactly that, the ethics of it, and struggling with the decision of how to do that. When making that decision, they have to go in and look at all kinds of considerations: age, like length of life, possibility of like the the chances that patient has to make it through the surgery. Another one of the principles that is being applied is the principle of non-maleficence. They are doing their best to not harm anyone, to make sure that everybody is being treated fairly, to be sure that everybody is getting what they need to the best of their ability. And the principle of beneficence, they're trying to benefit all of the patients that they possibly can. By making these choices, they're hoping to be able to benefit the person that's going to be able to save the best. I feel that the biblical aspect in all of this is that God loves all of his children, and that these hospitals and people working on the staff trying to make these choices are doing their best to make sure that they're saving as many lives as possible and keeping people as safe and healthy as possible. As hard as it is to make these decisions, I do feel that they're handling it in the best way possible. I think that it's very important to make sure that when you have two people who need a drug and you only have one dose of it, to make sure that you're not giving it to someone who is already about to die.